Welcome. I'm Robin Rothenberg, a certified yoga therapist specializing in yoga for multiple sclerosis. This is part of the MS Center at Evergreen Hospital's Therapeutic Yoga for MS series. In this session, we'll be focusing on the lower back. Please prepare yourself for this session by following the breathing practice from session number 1. To begin, you'll come onto your hands and knees. I recommend you get a blanket to put underneath your knees so they're well padded. Place your hands shoulder width apart and your knees and feet hip width apart. From this position, begin to just orient yourself with the movement of the pelvis. The pelvis has the ability to rock forward and rock backwards. Forward and back. As we move the pelvis forward, we move the back into a little bit of a back bend or a smile configuration from the crown of the head to the tailbone, creating a smile position with your spine. We'll be doing this movement on the inhalation breath. On the exhalation breath, engaging your abdominal muscles, your core muscles, pulling in, bring the lower back up into a domed position and allow the arms, the head, neck, and shoulders to fold down towards the floor. On the inhalation breath, rotating the pelvis forward, lifting the tailbone up, creating that smile position. Easy lift in the neck so you're not pulling your head back, but rather having your head in a more neutral position, shoulders down away from the ears. Exhaling, drawing the belly in, rounding the lower back, softening the arms, head, neck, and shoulders release, and the hips come back to the heels. Inhale, rotating the pelvis forward, a little bit of a back arch, easy lift in the head. Exhale, drawing the belly in, folding the arms down, relaxing the head, neck, and shoulders, hips release to the heels. Now, for those of you who are unable to kneel, you can do this posture seated in a chair. Place your feet hip width apart, your hands resting on your thighs, sitting forward on your sit bones and creating a nice extension, length in the spine so you're not starting in a slump position. With your exhalation breath, slide the hands down the legs and gently fold forward, stretching into the back, just as we were doing on the floor. With your in-breath, draw the arms back, lift the chest, coming into a back bend. A little bit of contraction of the back muscles, and then exhale, slide the hands down and fold forward once again. Let the head go, releasing tension in the neck. Inhale, slide the hands up, draw the shoulder blades towards one another, lift the chest, and then exhale and fold forward again. So this is a perfectly suitable variation for anyone who has discomfort or concern about coming onto the hands and knees. Let's have Karen and Peter join us, coming onto the hands and knees, placing the feet, creating as much padding under the knees as you would like. Knees are hip width apart. So begin by rotating the pelvis forward. So forward, Karen, with the coming into the smile position, lifting of the chest. And then as you exhale, draw in through the belly, relax the head, neck, and shoulders, and fold the hips all the way back. Nice. With your in-breath, coming forward, pelvis rotates forward, tailbone lifts. Be sure you're not pinching in the neck, dropping the chin a little bit, creating more space around the shoulders, and then exhaling, lift from the belly, relax the neck as you fold gently down. Again, with your in-breath, coming forward and up, shoulders draw down, away from the ears. Exhale, lift from the belly, relax the arms, relax the head, neck, and shoulders. Beautiful. Now from here, we'll transition and come on to the belly. We'll be working with the cobra pose in this position, which is a back strengthener, working all the postural muscles from the base of the skull all the way down to the tailbone. Very important for supporting the back, supporting the spine in standing and moving through life, as well as preventing or helping to alleviate lower back pain. Place your hands, please, with your forearms on the floor, elbows back by your ribs. Your feet are extended out, tops of the feet on the floor, and bring an awareness to the inside line of the legs, engaging the inner core muscles. The inside line of the thighs as if you were squeezing a block between your calves and your thigh muscles. Pelvic floor muscles are engaged, little drawstring action pulling in, and the lower abdominals are pulled in as well, so there's that gentle hugging of the belly in towards the spine. With your inhalation breath, you're going to use your back muscles and the breath to lift you, not by pressing through the arms. So with your inhale, lift your back gently away from the floor, drawing your shoulder blades towards one another, and then exhale and slowly release down. As you lift, you'll feel a little bit of tightening of the lower back muscles. That's because we are strengthening them. And then exhale and release down once again. As you breathe in, lifting the chest, keeping the neck relaxed and drawing the shoulder blades down so there's more of an opening across the upper shoulders. And then exhale and release down once again. This time, as you breathe in, lift your chest and your right leg away from the floor. Chest and right leg. And as you exhale, lower the leg and the chest. This time, chest and left leg. Chest and left leg. When you lift the leg, try and bring it directly up. Exhale down. Notice it may wobble a bit, but as much as possible, tracking it straight. Right leg and chest as you breathe in. Exhale, release down. And the left leg and the chest. Breathing in, draw the shoulders down, keeping space around the neck. Keep the chin slightly tucked. This time, both legs and chest if you feel able. Chest in both legs, shoulders drawn down away from the ears, chin a little bit in so there's no tension in the neck. Release with the exhale, and then one more time. Inhale and lift up. No pressure with the arms. Use your back muscles, and then exhale and release all the way down. Take a breath here, and then we'll make a transition onto the hands and knees for the wheel pose, the pose that we did earlier. So using your core muscles, pressing firmly through the arms, through the legs, and lifting through the belly to support your lower back as you come into the kneeling position. From here, set yourself up, palms spread wide, placed underneath the shoulders, knees underneath the hips. For those of you who prefer to be on the chair, you'll want to come back to the chair position. Coming onto the chair and connecting with your breath, hands on your thighs. With your inhalation breath, you're going to create that little bit of a smile, lift the chest, do a little back bend, that's it. And as you exhale, folding the hips back as the belly comes in, let the head, neck, and shoulders release completely. With your inhalation breath, bring the chest forward, roll the shoulders back, shoulder blades drawing in gently, creating that smile, that arch in the back, and then as you exhale, draw the belly in, let the head go. Let the head, neck, and shoulders release. With your inhalation breath, coming forward and up, lifting the tailbone, opening the heart center, exhale, and feel the back stretching as you gently take the hips back to the heels. Once again, inhale, coming forward, draw the shoulder blades down, drop the chin gently so there's no tension in the neck. Exhale and stretch into the back as you fold the hips back into the resting position once again. After taking a few breaths to just rest in this position, I invite you to come over onto your backs, get yourself comfortable with your knees bent, feet on the floor. You can take an extra blanket or a small pillow to place underneath your neck and head to make your neck more comfortable. Please bring your right knee to your chest. Bring your hands behind the back of the knee. And as you exhale, hug the knee in, behind the back of the knee. As you exhale, hug the knee in, and as you inhale, extend the heel up towards the ceiling, stretching into the back of the leg. With your out breath, exhale, bend the knee, fold the knee into the chest once again. Inhale and stretch up, press the heel up towards the ceiling, tip the toes down. Exhale, fold the knee in. And once again, inhale and stretch fully into the back of the leg. Exhale, bend the knee, draw the knee to the chest. Keep the shoulders and neck soft. Inhale and extend and stretch up into the back of the leg, supporting with your arms. And hold the position now. Continue to breathe and just circle the ankle gently. 3 or 4 times in one direction, making a nice fluid circle. Noticing if there's some jaggedy places. See if you can slow down and make the circle a little bit more cylindrical. Circling the other direction 3 or 4 times, feeling how it is to circle in the other direction, working all the muscles around the ankle and through the back of the thigh, back of the calf, circling in both directions, feeling all the muscles through the back of the calf and even up into the knee and thigh. Good. Then with your exhalation breath, fold the right knee into the chest again. Place the right foot back down on the floor and take a moment to just pause and feel. From here, bring your left knee into the chest. Hands behind the back of the left knee. With your in-breath, extend fully up through the back of the leg. Feel the stretch all the way up through the heel. Exhale, fold the knee to the chest. Once again, inhale and stretch, extending the leg as far as you are able comfortably, and exhale, fold the knee in. Once again, inhale and extend. Remember to tip the toes down gently so that you get a little more stretch through the ankle. Exhale, fold the knee to the chest. And this time we'll extend and hold the position and circle the ankle. Notice how this ankle circles. Noticing the movement, getting as much of a nice round fluid action as you can. Isolating the ankle, both directions, circling fully, stretching through the calf, through the knee, all the way up into the back of the thigh. And then from here, flexing the knee to the chest and place your left foot to the floor next to the right. Take a moment here to just pause and feel. For this next pose, which is bridge pose, I invite you to take whatever support you may have placed under your head now out and put it just to the side so that it's out of your way and your head can rest on the floor at the same height as the shoulders. From here, letting the head rest back and rotating the shoulders out so that your palms are up and you feel a little bit of the shoulder blades coming towards one another in the back. Place the feet so that they're even with one another on the floor, hip width apart. And in this position, with your inhalation breath, press down into the soles of the feet, lift the hips, and stretch into the front of the body. Feet stay on the floor, lifting the hips. As you exhale, draw in through the belly, inner thighs engaged, and curl the spine down one vertebra at a time, lengthening the lower back. Again, pressing firmly down into your mat with your legs. Inhale and bridge up, stretching into the front of the body. And as you exhale, draw the belly in, inner thighs working very strongly to squeeze towards one another, curling yourself down. So using your core muscles, using your inner thighs, pelvic floor, lower abdominals to support you as you bridge in and out. Bridging up on the in-breath and curling down on the out-breath. Slow release of the lower back to the floor. Excellent. From here, please just bring both knees into your chest, one hand around each knee, hugging them in as you exhale and pressing them back arm's length as you inhale. Exhale, folding in, and inhale, pressing back out. One more time, gently stretching into the lower back and the whole pelvis, the hips. Inhale, the knees come back, and go ahead and place the feet on the floor. And you can follow this segment with the last session, which is the deep relaxation.